and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, to HealthBeat, and as always, encourage you to continue participating in the program by calling 718-960-7241 with any questions you may have. That's 718-960-7241. And we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you, our viewers. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67. And you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing women's health issues with a particular focus on some of the important tests that are available to detect medical problems at an early stage.
Yes, Errol, these tests, whether a pap smear, HPV, or a mammogram, are vital to the diagnostic and treatment process. Joining us this evening is Dr. Tajuddin Dabiri, attending physician OBGYN at Bronx Lebanon's Women's Health Center. Dr. Dabiri is a highly experienced practitioner and an expert in the field.
Now, before we hear from you, Dr. Dabiri, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241, and please call us. Dr. Dabiri, let me start the program by asking you to provide our viewers with a general overview of the tests that are now available at Bronx Lebanon and why they're so important.
Thank you, Mr. Schneer. We have, in the Women's Health Center, we have pap tests, we have mammography, we have HPV. All these are screening tests to detect early form of disease condition, particularly cancer of the cervix or the breast. It's so important to do this early because of the prevalence of human papillomavirus infection in our community.
So by getting at the problem early, you're really solving a major potential problem.
Correct.
Okay. Can you define in more detail what a pap test is and why it's necessary? At what ages do you start screening?
A pap test is a screening test, and it is done to detect any abnormal cells in the cervix, precancerous cells. And how this is done is by scraping the cells of the cervix. We take this to the laboratory and view this under the microscope.
If they're abnormal?
If they are abnormal, then we will follow up with the patient for further treatment.
Yeah. When do you start the test? At what age?
The test is usually, we start it at age of 21, according to recommendation.
Okay.
The reason why we do this is because of the fact that the commonest cause of any abnormal cells in the cervix is HPV. And this is a virus. It's called human papillomavirus, and it's common in our environment, especially because of women are exposed to sex in an early age.
Okay, very good.
In terms of the testing itself, just how reliable is the pap test, and what age group most benefits from it?
The pap test is actually very reliable in detecting precancer cells, usually from the about 75 to about 90% of patients. However, the starting age is from 21 to age of 65.
Right.
The reason why we are starting at the age of 21 is that we want to detect any abnormal cells early so that that can be taken care of before a full-blown cancer of the cervix develops.
Right. Now, what about after 65?
After 65, most women that have had normal cells, they recommended that normal pap test results, they recommended that they do not need to have any further pap test. However, some women that have had hysterectomy due to previous cancer of the cervix, or some women that have had series of abnormal cells in the cervix, they are advised to continue till the age of about 70.
Yeah. I'm going to make your life more complicated. Let's move to another subject. There is much discussion and even controversy these days regarding the value of mammography. What is your opinion on the use of mammography? And tell us maybe some of the latest controversies.
Mammography is very, very important. It's been on for quite a long time. It's a screening test also to detect any abnormal lump in the cervix, in the breast. And also, it is also used to detect any form of cancer of the breast so that it can be picked up early.
Okay.
It's a screening test.
Okay.
And it is done usually in women from age of 40 and above.
Right.
However, some women that have previous cancer of the breast in the family, it's advisable that they start from around age of 35 and above.
Okay. All right, I'm going to give you a pass on this because it's very controversial nowadays. They think that we do too many mammograms. But I'll let you pass on that.
Now, HPV was the other important testing procedure that you mentioned earlier. Can you describe for our viewers just what the virus is and why it's so important to be vaccinated?
HPV is human papilloma virus.
Yes.
It is the commonest sexually transmitted disease in this country, and it is been found to be the major cause of abnormal cells of the cervix, which can later progress to becoming cancer of the cervix. So it's very, very important. Most women, especially in the 20s, are exposed to this HPV, and the only way it can be detected early is by screening them. And that is why it's recommended that women from age of 21 start their annual exam, including pap smear, pap test, at least every 3 years until age of 30, then where they can start doing it every 5 years if you do it along with HPV.
Yeah. Now, let's discuss the vaccination for HPV. Who should get it, and how effective is it? Additionally, are there any complications?
Well, thank you for that question. HPV, like I said, is human papilloma virus. It is recommended that every woman from age of 30 upward till 65, anytime they come for their pap test, should get HPV along with it.
Right.
Reason why they have to get HPV along with it is that will help us to determine how frequent we will do the pap test in such women.
Yeah.
However, for women that is from the age of 21 to 29, HPV is not usually done. It's not recommended except on the condition that when they have abnormal cells, we call it atypical cells, ASCOs, then HPV will be done in such women of that age group.
Yeah. But what about the vaccination?
The vaccination is very important. It's given from age of 11 to age of 26.
Yeah.
It's good for the vaccination to be given at that age before women are exposed to sex, before they start having sexual activity.
Right. Okay.
And that will take care of some of this organisms, especially the HPV that attacks the virus. However, the HPV does not cover all the virus because there are different types of...
So you recommend it?
I recommend it to women from 11 to 26 years old.
Right. Now, a very important question. What happens when the HPV tests or the pap tests come back abnormal? What are the next steps that you and the Women's Health Center staff must take to address the problem?
Well, if the HPV comes back abnormal and they have a pap test that is abnormal, then we want to go further to do what we call colposcopy. And that is depending on the type of the abnormality. Colposcopy is what we do in such a way that we look at the cervix and to see where the abnormal cells are. And we want to take a biopsy of it and send it to the lab to make sure that it is not a full-blown cancer of the cervix.
Right. So it's possible the colposcopy could come back normal,
Yes.
and you don't have to take any more steps.
We don't have to take more further steps.
And let's take it even beyond that. What happens? Follow us through to the...
Well, if, like I said, if the colposcopy is normal, then the women will continue with their screening as scheduled.
Right.
But if they have any abnormal colposcopy, depending on the type of what we have, then we can go further to remove certain part of the
Right.
cervical tissue
Right.
for treatment, which we call it maybe cone biopsy.
Right.
And that will help in treating the abnormal cells in the cervix before it progresses to becoming cancer.
You may have said it before, but if a woman comes at 21 and everything is normal, when is the next appointment given?
Okay. Thank you for that question again. If a woman age of 21, for example, normal pap test should not have another pap until 3 years after.
Okay.
It should be done every 3 years until age of 30.
Right.
And the reason for that...
And after 30?
After 30, it should be done every 3 to 5 years, depending if they have HPV done along with it. For example, if a woman comes in, she's 31, and she had a pap smear that is abnormal, and the HPV is also abnormal, okay, that will be taken care of. However, if they have a normal pap smear and normal HPV, that woman does not need to have another screening test until 5 years after.
Okay.
Okay. On that note, let's pause for a short break, and when we return, we'll continue our discussion, as well as take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241. And please call us.
In this year of neonatology, we recognize the extraordinary and successful life-saving efforts of our neonatal team. Every day, they are truly making miracles happen for the tiniest of babies.
We have saved thousands of babies throughout the years. There is nothing more satisfying than knowing that because of our care and attention, they can live their lives to the fullest as healthy young adults.
We care for each of our newborns as if they were our very own, including educating parents and assisting them in navigating the new journey with their child.
Seeing is believing, particularly for Norma Rodriguez and Raul Velasquez, the proud parents of triplets Nyla, Nilani, and Nayeli, successfully delivered by Bronx, Lebanon's high-risk obstetrics team.
Gently, very good. Okay, very good. Now we're 3 out, beautiful, very fine.
Triplets are a rare occurrence. The baby girls were delivered by a C-section in excellent condition. They received follow-up care in the neonatal intensive care unit because of their low birth weight.
And when it comes to follow-up care for these triplets, as well as other neonatal graduates and newborns, Bronx, Lebanon's pediatricians are making sure that they receive the necessary support.
During the first year of life, we check a child's growth, their development, and give all the required immunizations. It's a great joy to us that we're able to tell parents that they have a healthy child.
There are times when premature infants have swallowing, hearing, or breathing issues. That's when Bronx, Lebanon's ENT specialists are called into action.
Our physicians, audiologists, and speech-language therapists work closely with neonatologists in assessing these medically fragile babies. When necessary, we correct the problem and also instruct parents on using safe feeding practices.
Vision is equally important for newborns.
In premature babies, the retinal blood vessels are at risk of developing abnormally, which can lead to blindness. We are one of the first hospitals in the nation to offer laser treatment to correct this condition.
The bottom line is that Bronx, Lebanon is always there for its newborn patients and their families, as well as for the community. Its ER is a perfect example.
Our adult and pediatric emergency departments see more than 137,000 patients annually. We respond effectively to problems related to newborns, children, teenagers, and of course our adult and senior citizen population.
Bronx, Lebanon also continues to lead the way in anesthesiology, dentistry, family medicine, neurosurgery, orthopedics, pathology, psychiatry, surgery, radiology, nursing, and long-term care. Its Bronx Care Network, including a soon-to-be-completed 9-story ambulatory care facility as well as a new life recovery center for individuals that suffer from chemical dependency, is fulfilling Bronx Lebanon's role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now let's continue our discussion. Dr. DeBerry, a question we frequently ask our panelists is to share their respective backgrounds with our viewers. And I'm going to ask you to do exactly the same thing, and also describe some of your medical education and training as well.
Thank you very much. I completed my medical school in Nigeria, University of Jos Nigeria, about 22 years ago, and also went through a residency training in Nigeria in OBGYN before I migrated to this country with my family. And I've been in the obstetric practice also, went through another residency in this country, started from Brookdale Hospital and completed my residency in St. Vincent Catholic Hospital in New York here. And I'm board certified. I'm a fellow of American College of Obstetrics and Gynecology, and I've been practicing out of residency in this country for the past 8 to 10 years now.
Right.
And I'm married with a daughter.
And the other question, or the other part of the question, is what interested you in a medical career in the first place?
Thank you for that question. My interest in medical career has been from childhood, actually.
Right.
I grew up in an environment where I see a lot of, especially in African setting, a third world country, where children are born, they die prematurely without any attending to them, to their birth. So that prompted me to want to go to the medical practice, particularly obstetrics and gynecology, to help deliver, protect, save, and nurture these children when they are given birth to, and also to take care of women's health.
Okay, thank you.
Okay, switching here. Can the tests we have discussed, namely PAP and HPV, be given during pregnancy? And is it a recommended course of action if that's the first time you're seeing the patient?
Yes, it should be given during pregnancy. There's a belief out there that pap smear in pregnancy can cause miscarriage, can cause a patient to lose the pregnancy. No. It is done when a patient has not had pap smear in the last 2-3 years. When they are pregnant, coming for the first time, it is recommended that a pap test should be done for them so as to detect any abnormal cells. However, at times during the pap smear, you may have some little bleed, spotting here and there, but that should be of no concern because it does not really lead to miscarriage at all. So it is recommended that we do pap test during pregnancy.
All right, we have a question from unlikely source. Robert, can we get your question, please?
Yes, thank you, doctor. The question is, the HPV virus, is that something that males should be, as well as women, be vaccinated against?
Good question, good question.
Yes, thank you.
What about the men?
So far, at this point, the recommendation is mainly for the women because of the fact that the cervix is in the vagina, in the moist area, that the organism can thrive and survive. In men, it's only on the skin of the penis. And some men can develop warts, and that can grow on the skin. It's not yet recommended that men should have the vaccination. It's only meant for the women.
Okay. Well, I don't know if Robert is satisfied with that answer, but what about men who may have other issues?
Well, men, if they have any other issue, I will recommend that they see their doctor first, so that the doctor will take care of them and see what is growing on the skin of the penis.
Because they have warts too sometimes.
Yes, they can get warts too. Yeah. And once warts is developed, the purpose of us giving the vaccine is actually attack the virus so that the women cannot develop abnormal cells, cancer, and that can lead to cancer of the cervix.
Okay.
Right.
In men, it is very unlikely for them to develop cancer of the penis from any
And
HPV.
the disease is much more demonstrated because you can see it.
Exactly.
Okay. Very good.
Right. Now, another question we often ask our panelists is to share some of their patient success stories with our viewers? And I'm sure, Dr. DeBerry, you've had many. Can you share one or two?
Yes, I've had quite a lot experience in this area. I remember of a time I saw a patient. I had a patient which had a colposcopy, and eventually she was afraid of not being able to get pregnant subsequently, but we took care of this patient. She was scared that it was cancer of the cervix, but with our cone biopsy, it came back to be normal cells. And she eventually got pregnant again. She has multiple kids at this point. So that prompted me to believe the fact that women should actually undergo pap test every time, because it's a good experience.
How are you helping your patients address the problems associated with menopause, and how effective are these treatments for?
Well, we encourage, menopause is actually when the ovarian tissues stop producing all the necessary hormones that take care of the woman's body, especially estrogen. So we always recommend, because this is a natural thing that has to happen to every woman, regular exercise, a lot of water intake. There are so many different forms of treatment out there that we also recommend, especially if the treatment does not become effective. Regular diet, normal diet, good diet, regular exercise, a lot of water intake, avoiding of caffeine and chocolate drink will help to some extent in preventing the hot flushes. In women that have dry vagina, for example, we help them, give them some medication that will help the lubrication of the vagina, because one of the things that they explain they have is problem with intercourse.
Yeah.
So
good. What about hot flashes? I think that's the worst complaint they have.
Yes.
What do you do for that?
Hot flashes actually is one of the things that women that have gone through menopause does not like at all.
Yeah.
It's a terrible experience. In such women, we also, like I said, encourage them to take a lot of fluid, exercise regularly, avoid anything that would trigger that hot flushes. For example, some people, when they drink coffee, some people, when they smoke, that triggers that attack in them.
Yeah, so but that's not good enough, because there are many women who don't smoke and take very little coffee who get hot flashes that's disgusting for them.
Yes, if all those...
Address those.
If those things are not taken care of, they cannot take care of the hot flushes, then we want to proceed to hormone replacement therapy. Hormone replacement treatment. We start with a low dose treatment for a period of 3, 4, 5 years.
Right.
But we want to make sure such patient does not have any history of cancer of the breast or cancer of the uterus in the family in the first place, and they have to be monitored closely.
Okay, now expanding on Dr. Gums' question, what types of nutritional products or even vitamins do you recommend for your patients?
Yes, thank you. I don't want to advocate any
Not
vitamin
brands,
here, but
the
any brand. But patients that have undergone menopause should at least take a lot of vitamin B6 and vitamin B3. Most of the vitamin B will help them in suppressing their nervousness. And besides that, eat good diet. Regular diet, good diet that is not hormone leading, that is not contain a lot of cholesterol. So vitamin B6, vitamin B3 are really good in such patients.
Okay. What types of advances do you see occurring in the women's health field in the future? Shortly.
I see a lot of advances.
Just tell us 5.
Thank you. Especially in the women's area. In the obstetric part of it, I'm foreseeing a situation where we're now advocating home birth, which we're encouraging.
Home birth, that's a throwback to the Stone Ages.
It's going back to the Stone Ages, but a lot of patients advocate. We have our midwifery service. We have water births now, especially in Bronx Lebanon Hospital, where they come in and deliver. Right, our midwifery service are able to take care of that. And also in the gynecology aspect of it, with the screening test, if every woman, they're able to get involved in the screening test for the pap test and the mammography, we see at the point that cancer of the cervix and breast will be reduced to the minimal in this country if we're able to adjust strictly to it.
Expanding on what Dr. Gums just said, Can you give our viewers a general overview of the Women's Health Center, the services that are provided there, as well as the number they can call if they want to make an appointment with you?
Yes, Women's Health Center, Bronx Lebanon Hospital, we have the clinic is on the 14th floor. The outpatient clinic is on the 14th floor.
Right.
And we have a variety of maternal fetal medicine. We have urogynecologists. We take care of pregnant women. We take care of gynecologists. Those are not pregnant. Those are fibroid, bleeding, abnormal uterine bleeding. We take care of those ones. We have high-risk MFM, who specializes, take care of high-risk pregnancy as well. We have urogynecologists who take care of people that have urinary incontinence and death. And also we have REI, those that have problem with reproductive infertility. Right. They should also come. We have all those in our outpatient clinic.
One complaint some of my friends make about your clinic is that the wait is too long. What have you done about it since you came, and are you prepared to address that problem?
Yes.
Okay, yes, okay.
That's
a good enough answer. I don't want you to elaborate anymore.
Okay.
In the remaining time, can you briefly summarize or offer our viewers a recipe for excellent women's health care, apart from the waiting time?
Okay. Women should understand that health is wealth, and we have to invest in our health, time, money, in our health, in our body. Women should exercise regularly,
yeah.
And
diet.
Know the kind of food they eat,
yeah.
And let it be. They should avoid all the junk food out there, because those are the things that are causing all form of obesity, all form of cancer in the environment. And also, women should, if you are not married to a single person, use condom if you are going to have multiple sexual partners, yeah. Which is not even encouraged, but if you have, please use protection.
And re-emphasize the testing importance, because obviously that's extremely important.
Yes, those screening tests,
visits. Yeah.
Those screening tests are very important. Like I said, they are tests that are done to detect any form of abnormal cells before it leads to cancer. So women should come, get screened, get their pap test, get their mammogram. If you're age of 21 to 65, you are encouraged to have a pap test and a HPV test. If also you are from age of 40 and above, you are encouraged to have regular mammogram. So when we do this, we'll be able to detect any abnormal cells in the breast, any abnormal lump in the breast, or cancer of the breast, and also cancer of the cervix.
And you make sure they get their follow-up instructions.
Exactly. Very important.
And on that note, Dr. DeBerry, let me thank you for joining with Dr. Gumbs and myself on tonight's HealthBeat television program.
Thank you, sir.
And most importantly, let me thank you, our viewers, for tuning in this evening.
In the interim, if you, our viewers, have a question or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week at the same time.